So I made a video talking about the types of cases that I do not take as a certified dog behavior consultant. And this commenter had a great question about what about when these types of cases overlap, sharing that in their observation, there is often a lot of overlap and these cases don't fit into nice, neat categories. So thank you for the opportunity to talk about this in a more nuanced way. So for reference, the 7 categories I mentioned that I don't take in my work are manners, puppy training, service dog training, sports training, breed-specific training goals, cases that don't involve dogs, and separation anxiety. And it may also be helpful to know what I do take. So I work exclusively with cases that involve aggression or, and often with significant overlap, cases that involve nervous system dysregulation, which can mean trauma, anxiety disorders, hyperarousal, hypoarousal, and chronic stress. So first up, let's talk about manners. Manners is what we used to call obedience, not to be confused with the sport of obedience. So manners is like sit, stay, recall, polite greetings, loose leash walking. Manners is very operant focused. And with the always caveat that operant and classical conditioning are happening all of the time, I do very little operant conditioning in my work. And there are a few reasons for this. One is that agency is a huge piece of my behavior therapy plans. Agency is the belief that one has control within their environment. And agency is tied to things like resilience to stress, which is one of like the main 3 things that we are looking to improve in these behavior cases. And it's also just tied to well-being and quality of life. So when we are telling our dogs specifically what to do, we are decreasing their agency. And I'm not saying that's something that we should never do, but I'm saying that it really doesn't come up in my cases. And that's because we are often a lot more focused in my caseload around safety. Like the place where such things would normally come into play are safety concerns for my client. And that's where we're going to be using management more than operant conditioning that puts so much of the weight on the dog, because the dog is not going to be able to access that learning if they're dysregulated, which is like the peak time that we need safety and our management to work. So for example, I'm not going to work on necessarily like teaching my client not to bolt out the front door. I'm going to have a next pen around the front door. I'm going to put the dog away behind a second barrier before the door is opened. Because if my client has a history of bolting out of the door and biting someone, or bolting out of the door in a fear response and running away, relying on them to do like a stay would not be sufficient. The other reason that I don't do a lot of operant-focused work is because it messes up my data. If I'm telling the dog what to do, then I don't know what they were going to be doing otherwise, and body language and behavior are like 2 of my main data points. So I might, for example, work with a dog on shaping a relax on a mat behavior. I might make sure to preserve flight, so no implied stays, and I might really generalize the heck out of that behavior. But I almost never ask the client to cue that behavior. We are more, in that case, working to set the dog up so that they consider that an option when they need a break, when they need to feel safety, when relaxation would feel good in their body. If I tell the dog to lie down on the bed, then I'm missing a lot of data. Because let's say I'm doing a setup, we're doing some engage, disengage with a trigger over there, and I have my bed handy and I'm putting my treats on the bed. If my dog normally would lay down on that bed, but they're standing or they're sitting instead, that's great info about their arousal levels and about their comfort in the situation. And I could cue them to go down or to go into the bed, but then I would lose that data. Okay, next up, breed-specific training goals. So there might be a little bit of overlap here in that I may be working with a dog who is engaging in behavior that is breed-specific and normal for the breed, but it's appearing in a problematic way or in a problematic environment. A lot of my clients who are experiencing that often also have a mix of anxiety and dysregulation, and so it's like 2 things are happening. And it is important to be able to recognize those two things. But generally, the limit of my support in that realm is to manage and teach alternatives to the behavior, not to actually promote that behavior, or to put the dog in a situation or help them succeed in an environment where they're gauging in breed-specific work. That would be something I refer out. Puppies! So I do work with puppies sometimes, but they are not puppies who are developing normally. And so we're not working on like your typical socialization, potty training, that sort of thing. Typically, if I'm working with a puppy, we are rushing to get them an emergency spot with a veterinary behaviorist. We are often putting socialization completely on hold because in a lot of these cases, the puppy cannot be exposed to other dogs and people and sounds and things in a way that allows them to feel safe. And so we're trying to find ways that we can do that if we're still within that socialization period, so that the problem isn't getting exponentially worse, because it is such a sensitive time. So I do work with puppies, but not those who are developing normally, and I would refer a normally developing puppy out. Service dogs. So my clients generally don't make good service dogs, but there are some exceptions to this. So in one scenario, I might be working with a dog who was originally intended to be a service dog and things are not playing out that way. And there may or may not be hope of getting the dog to a place where they can one day perform those tasks. The answer is usually no. And there are some ethics around working a dog who needs behavior medication or who is disabled themselves, and I'm not going to dive into that in this video. But that is typically when I work with service dogs, is when they were intended to be a service dog and things are going off the rails, and usually their trainer has referred them to me for support. I do sometimes get to collaborate with my dear friend and colleague Adri of Helping Hands Alberta. We have been able to share a couple of cases together. They are a service dog trainer, and I cannot recommend them enough. But again, those are generally cases the service dog work is on hold while we see what we can do to support the dog otherwise. Separation anxiety, I would absolutely say this is the one with the biggest overlap in my caseload. Separation anxiety is a clinical diagnosis, and technically it refers to dogs who are distressed when they are away from their one person. This is a bit of a spectrum. So there's also isolation distress, which means the dog, it doesn't have to be one specific person. They're just distressed when they're alone. And alone is relative, so some dogs are okay if there are other pets in the home, but usually we're talking about dogs who are not okay if there's not another human around. And then there's also hyperattachment, which can show up where the dog is distressed when they can't access their human in the house. They're always following the human around, but they may or may not be okay when someone actually leaves. And so for my cases, it sort of depends on whether this is the main issue, whether it's something that we can manage while we work on other things, and sort of where on that spectrum it is. I can help with hyperattachment. When we're more in the isolation distress or separation anxiety realm, I want to bring in a certified separation anxiety trainer. That might look like collaboration at the same time, but often we want to manage one set, either the separation anxiety or the other behaviors, while we work on the other, because both are like a super full-time job. That's a lot for the client. So some might manage their other concerns while they work through a CSAT protocol, or they might manage the separation anxiety while we work through some of the other behavior concerns. Sports! Anytime my dear friend Lily of Brave Boy Milo sees their dog do something athletic, they say sports, and that's what that reminds me of. So same sort of thing here. I'm typically not teaching sports things. I might teach like some nose work, but that's like for fun at home. Typically where sports intersect with my work is I will work with dogs who were doing sports stuff and can no longer do sports stuff because of their behavior concerns. This is a really interesting population. A lot of times these dogs have always had these behavior concerns, this anxiety, this reactivity, but it's been contained enough in an environment that is very familiar and predictable to them until it's not. And then usually that's when they come see me. We are often in those cases putting sports on hold, but I might have some clients who are doing sports, but they are being taught that by other trainers. I'm going to try to fit in this last one, no dogs. So if the case just doesn't involve dogs, that's not for me. But if the case involves dogs and other pets, again, it's a balance. So if I'm working on a case with dogs and cats, but primarily we need to focus on the dog, that might be okay. Or I might bring in someone who specializes in the other species to collaborate. It is so important to consider the well-being and the needs of all the species involved, and if I can't adequately meet those needs for the other species, I call in help.